What do we know about the virus? This is an RNA-containing virus from the group of coronaviruses, of animal origin, which most likely got to humans from bats. There were hypotheses about snakes, but so far we have stopped at mice. Greek scientists have found that the genome of the SARS-CoV-2 virus is 96.3% similar to the RATG13 bat virus. Due to what mutations it acquired the ability to infect humans, it is not yet clear, but the probability that SARS-CoV-2 came from bats is very high. In the case of a favorable outcome, the disease ends with a full recovery within an average of 14 days and leaves no chronic consequences. In severe cases, the disease can last up to 8 weeks. How does infection occur? There is almost no recorded transmission of the virus from animals to humans only at the beginning of the epidemic. At the moment, all the patients were infected from humans and had no contact with animals. According to current WHO data, the disease is transmitted from person to person through small drops released from the patient's nose or mouth when coughing or sneezing. These drops fall on the surrounding objects and surfaces. Other people may become infected by first touching such objects or surfaces, and then touching their eyes, nose, or mouth. In addition, infection can occur by inhaling small drops that are released when a sick person coughs or sneezes. For this reason, it is important to keep away from the sick person at a distance of more than 1 meter. According to current scientific data, small drops released from the respiratory tract are a more significant factor of transmission than air. From infection to the first symptoms, the incubation period takes from 1 to 14 days, but on average 7. This is very important, because a person who does not yet know about their disease can infect others. This virus uses the S protein on its crown to attach to the angiotensin-converting enzyme 2, ACE2, receptor, just like the SARS virus that occurred in 2002 to 2003. The difference between 2019 CoV and SARS-CoV is that it is more resistant and more easily attached to the receptor, meaning it is more infectious but less fatal than SARS in terms of mortality. Contagiousness. In epidemiology, there is such a concept as the basic reproductive number, R0, the number of people who can be infected around a sick person. R0 Wuhan coronavirus 3.3 to 5.5. R0 flu 1 to 2. The R0 of influenza the Spanish flu 2,8. R0 for measles is 12 to 18. That is, it is 2 to 3 times less contagious than measles and 2 to 3 times more contagious than the flu. Stability in the external environment. In the external environment, coronaviruses are inactivated from surfaces at plus 33 degrees C in 16 hours, at plus 56 degrees C in 10 minutes. A study by Italian scientists shows that 70% ethanol, 0.01% sodium hypochlorite and 1% chlorhexidine damage the virus capsid very quickly, less than 2 minutes, and it cannot reproduce. Another study tested popular hand sanitizers based on 45% isopropanol, 30% N-propanol, and 0.2% mestrinium ethyl sulfate, based on 80% ethanol, 85% ethanol-based gel, 95% ethanol-based antiviral gel. All hand processing tools destroyed the virus below the detection threshold within 30 seconds. Coronaviruses remain in the aerosol for 8 to 10 hours, in water up to 9 days. Against aerosols of coronavirus and to remove it from the surfaces of objects, UV irradiation with quartz lamps is effective. But the time of destruction of the virus by a UV lamp depends on its power and is usually from 2 to 15 minutes. According to WHO, an aerosol capable of infecting others only spreads within a radius of 1 meter around an infected person, and coronaviruses are not able to be transported in an aerosol over a greater distance. Coronaviruses retain infectious activity for several years in the lyophilized state, at plus 4 degrees C, in the frozen state, at minus 70 degrees Celsius. Most often, the disease begins with weakness and malaise, fever, and dry cough. Some people may experience pain and aching in their muscles and joints, nasal congestion, runny nose, pharyngitis, or diarrhea. As a rule, the symptoms develop gradually and are quite weak. Some infected people do not have any symptoms or feel ill at all. Later, the cough may increase, there will be chest pain when breathing, shortness of breath. These symptoms may be signs of developing pneumonia and should alert you it is better to call a doctor. According to the work data, the overall mortality rate remains at 2.3%. The highest is in the group of people over 80 years of age, 14.8%. In the group from 70 to 80 years 8%. No children aged 0 to 9 years have died. In the group of 10 to 40 years, the mortality rate is 0.2%. More men died than women, 2.8% and 1.7%, respectively. Test systems and PCR diagnostics are used for diagnosis. The main type of biomaterial for laboratory research is a smear from the nasopharynx and/or oropharynx.